Hi everyone and welcome back to the channel. Now before we dive in, I want to remind you that this video is for educational purposes only. It's not meant to diagnose or treat OCD, and if you're experiencing symptoms, I strongly encourage you to reach out to a qualified mental health professional. Now today we're going to be talking about obsessive-compulsive disorder, what it is, its symptoms, causes, and how it can be managed. Now, OCD is a mental health disorder characterized by persistent, unwanted thoughts known as obsessions and repetitive behaviors or mental acts known as compulsions. These obsessions and compulsives can significantly interfere with the daily lives and cause distress. For example, someone with OCD might have an intense fear of germs and repeatedly wash their hands to the point of irritation, and that's going to be that compulsion aspect. So OCD is a very interesting mental health condition because it really has those two components that need to be present. You need to have those obsessions or those intrusive thoughts that are always, troubling the patient, and then those over-the-top compulsive actions, right? So we can see this with contamination, again, with excessively washing their hands, or like the need for symmetry. These patients are always arranging things to the point where they can't even get like that job or task done because they're so overwhelmed. And there's also like if patients, get worried about leaving like a burner on at their house, they'll leave their house and they'll have to always keep returning, and they won't even be able to leave their apartment complex or house for hours on end because they're just constantly worrying about that. So that is an interesting part. Now, everyone with OCD experiences not everyone experiences the same symptoms, right? But here are some common obsessions and compulsions. Like we said, the fear of contamination, excessive concern about symmetry. We have pathological doubt. So they're always checking things to make sure they're locked or appliances are off. Or counting and tapping and repeatedly repeating words silently. Now, the exact cause of OCD isn't fully understood, but research suggests that it may be linked to genetics, brain structure, and environmental factors. So it could be linked to your brain chemistry, like the difference in serotonin levels, genetics, a family history of OCD, and environmental factors such as stressful life events or trauma may trigger these symptoms. And we don't really know the percentage of what weighs more and what weighs less and what can have a more profound effect than the other. It's more of like a mixture of these factors that really make up this illness. So thankfully, OCD is treatable, and there are several ways we can manage this. And the best way is using this holistic approach, using what we can. So the first thing we're going to talk about is cognitive behavioral therapy. Specifically exposure and response prevention, right? This will help individuals face their fears without engaging in those compulsions. And we can do this in a stepwise approach where, say, we have a patient that's worried about germs. We can have them touch a doorknob and then help them not go and instantly wash their hands, and try to reinforce and tell them, look, listen, those fears that you have or what's going to happen, you haven't become sick, and kind of ease them into overcoming that fear. Now, medication that we can use for these patients with OCD is actually SSRIs, or our selective serotonin reuptake inhibitors. And these are often prescribed at a higher dose than normal. And this is because we need a little bit more serotonin reuptake inhibitors to help these patients with their fears. And the trial, interestingly enough, is also longer at about 12 to 16 weeks. There's also lifestyle changes that we can make. That these are always beneficial, like regular exercise, stress management, and having mindfulness techniques can help reduce the symptoms over time. Now, OCD is often misunderstood, but awareness and treatment can make a big difference. So if you found this video helpful, please like, subscribe, and share to help spread awareness. And remember, if you or someone you know is struggling with OCD, don't hesitate to reach out for professional help. Please let me know in the comments if you have any questions or if there's any other topics you'd like me to cover. Thanks for watching, and I will see you in the next video.